Good morning again. Kimberly and I are going to be talking to you about a guidebook that we co-authored along with another co-author who's not here today, and we'll acknowledge her a little bit in the end. But I'm me, you know who I am. That's my son. His name's Alon. He's cute. I've had the great fortune of being able to incorporate my experience with rare disease into my career, and it's allowed me to meet some really, really amazing people, including Kimberly. And I have had the great fortune of working with her and putting together this guidebook, which we'll talk to you about today.
So hello everyone. It's great to see you, Kimberly Haugstad, and as Melissa mentioned, I am the CEO of Upequity, which is an organization I co-founded a couple of years ago. Have been working within the rare disease space though since 2008. I am a rare mom. I think that's my number one. I always come back to being a rare mom. I have a son who is 20, born in 2002, and he has a condition called severe hemophilia B, which is a kind of a rare form of the rare hemophilia. It's also called factor IX deficiency. So he has a lot of interesting challenges with internal bleeding and hemorrhaging for no known reason and whatnot. So we spend a lot of time in and out of the hospital and with his treatment. We don't do a feeding tube or intubated or those kinds of things, but we do at least 3 times a week, sometimes daily, infuse him with an IV. And so our sort of life has been very different than we expected having kids, but finding the rare disease community has been such an incredible blessing and wonderful opportunity to get to know, and I'm so honored to have an opportunity to be here today and meet so many parents over the last couple of days, and kids and families, and so thank you for the opportunity to be here today.
Why don't you talk to us a little bit about what you want to do today?
Yeah. So today is really easy. Mousumi mentioned we co-authored a guidebook about a year ago. I think it was published about a year ago with a nurse, and what we want to do is share the guidebook with you. If nothing else, we want you to take away today 3 key things. We want you to know you do have access to this guidebook, learn a little bit about how to use the guidebook, and then use it as a tool. Find ways within to be able to, in your own life, even if it's one thing coming out of that book, we want you to walk away and leverage it. We are not alone, and I think it's just so important for us to always, just know that. It feels very isolating at times, and we'll probably talk about that along the way. But hopefully within this guidebook, there are tools that can be a benefit to you.
Absolutely. So just a little bit of background about why this sort of what was the sort of driving force in putting this guidebook together. Some of you guys participated in a focus group that we did at I think it was the 2017 GFPD conference in DC. Thanks, Katie. I think it was a really a lot of it obviously was very validating for me because it was a lot of these experiences that I had myself, but I learned a lot about everybody else's experiences. So when we put that study together to be published, for presentation, one of my graduate students had actually put together this word cloud that really describes some of the themes that we talked about during those focus groups. So I'm sure you guys as caregivers can look at some of these words and really identify, with some of the sentiments here. And one of the things that I remember hearing a lot from a lot of people is describing their experience as a roller coaster. Taking that, and then in 2018, the National Alliance for Caregiving did a survey study that they sent out to parents of children with rare diseases and asked a little bit about their experience. And in that report, it came out certain policy recommendations that really urged for trying to address the health of family caregivers, trying to help caregivers achieve financial security throughout managing the medical care of their child, getting training and accurate information about their child's condition, and really improving care coordination between the healthcare providers of these children. And that really served as the sort of stage for developing this this guidebook, and this guidebook is, this is a series of guidebooks that are put out by the National Alliance for Caregiving. This one was particularly focused on guidance for caregivers of children with rare and serious illnesses. So, before we even get started on the contents of this book, which we'll go over very quickly, I wanted to just give you the access to this guidebook, so you can just take your smartphone out and focus in on this QR code, and you should be able to get it. And if it's too far away, there's another, there's some of these, like, what are they called, table card thingies, where they've got the QR code, so you can take a look at it and at your leisure. And you can take a look at it right now and just sort of start flipping through it as we're talking. As you guys are sort of taking a look at it, I'll just tell you real quick. So in order to, as a way to address those policy recommendations, the purpose of this guidebook was really to provide, a relatively comprehensive set of resources and guidance to address some of the challenges that our caregivers face, and provide some awareness of different programs and other resources that caregivers may be able to use in managing the care of their child and their family. And basically what we did to sort of figure out what do we want to include in this guidebook, really we went to caregivers themselves. So we conducted a series of interviews and focus groups with caregivers of various, various types of rare diseases and experiences, and we asked them, okay, if there were to be a guidebook for caregivers of rare diseases, what would you want to see in them? And we took those interviews and those focus group, that information from that focus group to basically come out with the outline for this guidebook, and that's really how the chapters are kind of broken down in the guidebook itself. So here are the different chapters of the guidebook. We're gonna just, very brief overview, and really we want to spend the rest of the time just sort of asking questions. So we'll just, these are the chapters of the guidebook. This is not meant to be something that you read from cover to cover. This is meant to be something that when you are in need of a particular resource that falls into one of these categories, you go to that chapter and you can get what those categories are. There's also an appendix in the back which we'll address.
There's kind of a trifecta here, a trio. In every chapter, throughout the chapter, we've embedded helpful links, and it's not exhaustive. There are other links out there, but as many as we could come up, over 100. I think over 100. Yeah. Different links that we've resourced over time. At the end of every chapter, all of those links are summarized, and then in the appendix, they're summarized. So it's really to address any kind of learning style as you're going through the process, how you can find the information sort of in 3 different ways to make it as useful as possible.
Right. So as we go through this sort of overview, just our first chapter is really, when I did these focus groups with these families, I wanted, one of the things that everybody seemed to say is that yes, we do need help, yes, we do need these resources, but caregiving isn't all bad. There's a lot of things that happened to me as a caregiver, that really helped me grow as a person, grow as a family, and they really wanted to, I know this was meant to be a guidebook, but I couldn't, it was so pervasive in all of our conversations, we couldn't, not address that. So that's what this first chapter about is yes, caregiving is very hard, it's a roller coaster, but it's also done a lot, it has the, this experience has the ability to have deep impact in your life. So I thought we'd sort of start off there. This next chapter is really, again, you've already learned that, equity, inclusion is something that's extremely important to me. And that was something that also came up in our focus groups. We had caregivers from very diverse backgrounds, and some of them did talk about their differences and experiences in dealing with medical care providers or what have you. So we wanted to sort of highlight the work that the RDDC, the Rare Disease Diversity Coalition, is doing. And that's what they talk about, that resources. There's also resources for dad caregivers or male caregivers. And also it describes a section where children or siblings serve as caregivers, just to sort of, again, try to address the fact that not every single caregiving experience is the same.
And I think it evolved over time. I don't think we actually had identified caregivers as children caregivers early on. That was a late addition.
The national element.
So we just kind of
put it in there. Yeah, absolutely.
Always something new.
Yeah, sure.
Can do that. So another really important chapter to all of us, of course, is diagnosis, and I encourage you to take a look at this chapter. This chapter is really powerful because it covers some thinking through in how to find specialists and how to really identify kind of your own need, and if you have to create it, a center of excellence. There are centers of excellence for some diseases. Sickle cell has centers of excellence, hemophilia, SMA, spinal muscular atrophy. Duchenne has centers of excellence throughout the country that are dedicated centers to holistically sort of soup to nuts work with our kids.
Here have talked about
Development. Yeah, there are more coming, right? So that's really exciting to hear. We also, through the process, we've added some information about the one rare disease center of excellence that is established in Washington, D.C. It was about 2016, 2017, I think it was established. So about 5 years now, this rare disease center has been in existence, covering all rare diseases, which is really exciting. We also included some information about genetic testing and just other resources for the undiagnosed community. So this chapter really covers that whole concept, soup to nuts of diagnosis. And you'll see here, this is the column that you can't really see very well. It's there really to illustrate at the end of every chapter. There's that laundry list of all of the resources that might have come up through in that chapter. The next slide. So this is managing health and medical care for your child, another chapter that we thought was really important to bring up today. We know there are, hundreds of drugs that have been approved just in the last couple of years. We also, it's an established fact, every year several hundred, around 250 new diseases are identified. So this is a crazy world that we're in, right? With lots of technology changes, and I think in the handbook, in the guidebook, we talk about the interesting, what do we call it, the challenges of the medical system. What do we call it? We were politically correct in the fact that the medical system is pretty messed up sometimes for us.
I think you called it fragmented.
Fragmented, that was the word. Good word, right? Fair word. We'll use it. So this chapter really talks about how to navigate, how to really walk through that process, how to come up with, just how to work through your decision making. It's too bad there isn't like a parenting, training that you can go through to become the absolute perfect know every decision to be made that doesn't exist. The guidebook is here to help you in that decision process, but there are just some great tools in this section. There is a checklist actually that I thought was kind of fun that we included that really speaks to helping you put together and think through, how to pull your care team together. But also from a sort of an emotional, psychosocial perspective, does your care team provide what you need? Do they communicate with you in the way that works, etc. So the tools in the book do address both types of situations.
So here's a little quiz that we have for you guys because, why not? So let's talk a little bit. You guys as caregivers, who are the people as parents of, and caregivers of patients with peroxisomal disorders, who are the people that are like the healthcare professionals that are really the key people in your team right now at this moment, knowing that it's probably been different before. So who wants to start this conversation off? Who do you really rely on in terms of your care team, in terms of management of your child? Go ahead, David.
It's her mental health day. Is it day to day? She's there every day. She sees all the stuff that goes on. She knows probably more than I do about everything that's ever going through. So after the doctor.
That's awesome, and I'm so glad that you have that support. Who had their hand up in the back? Go for it, Mike.
Endocrinology.
Endocrinology, absolutely. Absolutely. Go ahead. Sorry, in the back. Kid, right?
Our GI doctor is kind of like our head and manages all the bone density and MRI and everything.
Absolutely. I remember, and I know GI has been the sort of ongoing topic in this conference, and I know we're having a GI panel, so that's great. Go ahead, Vicky.
Our geneticist, I know that some families they get the diagnosis and then we don't really, see that again. But for some reason she's been our bud, so we kind of work with her and she helps us with.
That's great, and I think it's really funny, not funny, but it's interesting how we see that, the sort of central doctor can be any sort of specialization. It's basically just who you sort of connect with and really who takes the time to understand your child. Does somebody have a hand up over here? Oh, let's go Ashley and then we'll go Nancy.
Currently the predominant one has been audiology since our church got his very many years ago, so that's been pretty predominant with a lot of appointments, and then also coordinating our move and offering help with that, so that's been one thing.
That's great. Thank you so much for sharing that. Go ahead, Nancy.
I agree with everyone as far as the team, but also I feel the physical therapist has an awful lot to do, and that TJ's physical therapist happens to be here. She was having problems, she was able to get in without movement and everything, so she knows all the stuff, she knows how to do stuff, moving, where I might not be able to move his legs, I wasn't talking necessarily.
That's how we do it.
She has showed me how to do things to make it easier also on me, so I don't get hurt, because if I get hurt, what's going to happen is too much harm.
Exactly.
So I have to protect myself too.
Thank you. Go ahead.
I'm sure this is the case with many specialties. We found, especially with physical therapy, it was important to get the right one.
Yeah.
Right? Like, please don't give my child somebody who usually does hip replacements and knee replacements. We need someone who's going to be forward thinking about equipment needs and about, what might be coming in the future. So that was hard.
And I think that's a really great point. I'm sorry, can you tell me your name again?
Michelle.
Michelle, thank you. I think that it sort of leads into this other point of it's not just finding a specialist or finding a person on your care team, it's being able to shop around and finding who works for you, and that's a really important part as well. So here,
And being okay to fire one.
yeah,
And move on to
exactly.
another.
I hear from families all the time. Go ahead.
It's not from the child standpoint, from the parent standpoint. We had a real good family pediatrician that knew we knew more than she did. And basically, whatever we needed, she signed off for. Taking her away from our work, she was like, hey, yes, whatever you need.
Right, that's great.
To help us.
Just facilitate us being able to keep moving forward.
Right.
We wish everyone to have that.
And I think,
Yes.
that's a very common thread is that, a lot of families have shared that, the best kind of doctor is the one that is willing to work with you and collaborate with you and recognize that they don't necessarily know everything and that you bring a lot to the table too as the caregiver. Do you want to talk a little bit about the ones that we hear?
Well, and all of it's part of your decision making and building that care team. What we did here, and part of the reason for the pop quiz is just to to illustrate that there are so many medical providers in our lives. There's a nurse, practitioner, there is a social worker, there's this endocrinologist, can't even spell endocrinologist. So, there is, just every opportunity. We have a brief glossary started here, but just to encourage everyone to really think through what all of these doctors and clinicians, what they do, and just be able to keep that straight is really, really important.
Another chapter in the book is really, understanding that, the medical care that we have to provide for our children can get really costly, even when you have, in my case, we had two insurances, and then we still had a good, $100,000 in addition of costs that, outside of insurance that we were responsible for. So this chapter talks a little bit about, how to manage, getting sort of a case manager when you're going through insurance to make sure that you get coverage for everything you're supposed to get coverage for, any government programs to help with financial assistance. One of the resources that I talk about there, and a lot of these government resources, they may be at a state-by-state basis. I live in the state of New Jersey, and I found out about this resource from a friend of mine, who's in the room, who was listening to, was it NPR that you were listening to? And it was, and they were talking about a program called the Catastrophic Illness in Children Relief Fund. I said, well, that sounds like me. But I wouldn't have found it unless, my friend had told me about it because she had been listening to NPR that day. And, but there are some of these state programs and they actually ended up covering 95% of our additional costs. And we just had to do a little bit of legwork for it. So there are resources for sort of broadly for programs, and then it highlights some of these specific state-to-state programs. And I know that the CICR Relief Fund program in New Jersey is there as well. And then it also talks about if you're a participant, there's like if you need to travel for clinical care or clinical research, there's things like Ronald McDonald House and other similar resources to help defray some of the costs of traveling for care. And then, so here is just the website. Again, it's not meant for you to like read it right now, but first certainly take a look at the guidebook, and if that's something that's useful to you, it's meant to be. You want to add something?
Just that resources aren't always readily available. Hearing it on NPR, the backwards way isn't like you go while you're in your doctor's appointment and they're sharing a list of resources.
Exactly.
So it really does. It takes a little legwork, and we're hoping the guidebook, helps individuals launch that process.
Right.
And there are some great resources, particularly in this session, because we know the cost of living with rare disease is crazy compared to others.
Absolutely. And certainly, the resources provided here are not meant to be, we try to be as comprehensive as possible, but it's only like 50 pages or so. So there's obviously, hopefully it'll just, even if the resources that you need aren't necessarily here, hopefully it'll start you on the path of, doing the search and doing some legwork to find the resources that are right for you, no matter whether they be with finding a care provider or with financial assistance or, whatever. Another chapter we have in here is about education and recreation for the patients. So this goes very extensively into what a 504 is, what an IEP is, how to use that to make sure that your child gets the access to the education that they need and the resources that they need to help with that educational experience. We also talk about extracurricular activities. There's certain camps that are meant for children with disabilities. We talk about the Special Olympics, and other resources as well. And then the next chapter is talking about achieving quality of life as a family. So in addition to education and recreation for your child, it talks about how to navigate, having moments of just sort of normal family life with your child, despite this rare disease diagnosis. So it actually in that book, it talks about, talking to members of your immediate family in terms of how to ask for support. It has a section that's addressed to extended family members about what a lot of times families need. Talks about communication within the family, and also talks about how to find resources within the community to help provide support, whether it be through meal trains or something like that. As well as options for vacation and travel. So it covers certain theme parks that have disability access passes and how to go about obtaining them. Do you want to talk a little bit about future care?
I can, as the mom of the 20-year-old. Yes. I have to say, turning 20 18 during COVID was an interesting, experience. At age 18, with my son, he wasn't ready at 18 to be independent in any sense, I guess, living in my basement. But you lose so much, and where there are tools at the pediatric level, when you move to the adult level, it's different. It's really different, and if your child is able to consent and and is able to participate in decision making, it's really, really complicated, and there's no rule book there as well. But what we're trying to do is offer some thoughts and ideas around how to establish guardianship. If your child is going to live in a separate residence, how does that work? How do you do that? Special needs trusts, so SNTs are covered, ABLE accounts. So as you think out over the lifespan, your lifespan, your child's lifespan, in terms of looking at that planning, there are a lot of resources identified here to help in that process.
I think it's really important to recognize that we do so much as caregivers, and we spend so much time taking care of other people that sometimes we forget that in order for us to be able to take care of other people, we need to take care of ourselves. So this sort of and I'm sure all of us have been told by people, what are you doing for self-care, and you're getting self-care, right? But then the conversation sort of ends there, and it's well, how do I do this? So we have included just a few, just some discussions of why it's important, even though we already know why it's important, but also some resources. There are some, organizations that actually do try to provide respite for families like ours. So we've included some of those resources in the guidebook. And then
go back for it there for a second. Has anyone, during COVID, I saw this happen, I don't watch TV a whole lot, but do you remember even on television there would be those commercials that would come on and it would just say for 30 seconds, chill. Anyone remember those? Seeing those? Aren't they incredible? Oh my gosh, I took advantage every time I saw them.
I think they still do that, yeah.
I love them. It's 30 seconds just for you, right? Just to breathe. Just
right.
Incredible.
And I think you raise a very good point here, is that, when we're talking about self-care, when we're talking about respite, it doesn't need to be this big grand gesture. It can be just simply taking a moment for yourself and being like, this is my time and nothing else. And that in itself can be useful.
And giving yourself permission to let someone else be in charge.
Exactly. And then, since you're the advocate powerhouse, I'll let you take this.
Yeah, we're all advocates. Oh my gosh, the film that was up here, the mom and dad that were on film,
Kaylin.
Oh my gosh, amazing advocates, right? I mean, they stood up, they got what they needed. And I think we are advocates in every aspect. It's at school, it's in our own work to be able to get a combination to be able to take care of our kids. We're advocates in so many different ways. This particular chapter speaks to policy and how to be involved in change, and talks about how to tell your story, how to get involved from a state and federal perspective. And there are state coalitions you can be involved in. New England has a WARE coalition, Texas, Alabama, lots of opportunities to get involved at your state level. The Every Life Foundation, that I know supports this organization as well, does a really good job of connecting both state and federally. And if you haven't peeked out to look at the broader rare disease community and getting involved together, collectively as a power, we're 30 million strong from a patient standpoint, and it's really important. And we have something important to give. Wherever you're coming from, you have a story that needs to be heard and shared with the world, really. So that's what this chapter is about.
So this is actually one of my favorite parts of the guidebook, because again, this is not a book that you're meant to read from cover to cover. This is supposed to be something that you pick up when you need it and be like, okay, I need to look into something. And we have our chapters to give you a little bit of guidance, but all of our websites and the helpful resources that we've included at the end of every chapter is cataloged at the end here, so that you can so it has easy access for you to just sort of flip to the back and be like, this is what I'm looking for, and utilize that resource if you have the ability to do that. So that's really the ins and outs of the guidebook. We don't really want to take up any more of your time to discuss these details because you have it in front of you. So feel free to ask any questions, but overall, this is really just meant to be a guidebook that is meant to help us as caregivers, because we need it. We need help sometimes, and it's okay to ask for help. And hopefully, this is something that can be part of your toolbox to, in terms of managing the care for your child and managing the care for yourself as well. Do you want to add anything?
I just want to ask for a promise, everyone at least take a peek.
Yes.
Just take a peek, and if you can't find anything, you could share it with another caregiver who maybe could.
And please feel free to give us feedback on, if we were to do future incarnations of this guidebook, what would be useful
We actually have approached the National Alliance for Caregiving and asked them to take a relook at the guidebook and readdress it for our Spanish-speaking population.
Yeah, that was something that we definitely wanted to do somewhere down the line. We also wanted to recognize our co-author, Terry, who's not here today, but Terry offered a lot of information. When we talk about the future and transition of care, we include resources for things like palliative care, if necessary, and Terry was really integral in adding those parts in her experience as a nurse.
Yeah, nurse and home care nurse.
Yes, indeed. And so obviously this was something that was put out by the National Alliance for Caregiving. So there were a lot of people in the National Alliance for Caregiving who helped us put this, bring this to fruition. And I have a lot of help at Montclair State from my students.
We talk about this all the time, and we're promoting it all the time. We should probably mention it is free.
Yes. Well,
yes.
Yes, hopefully they didn't have to. Yes, right. Okay, so that, and yeah, just want to say thank you for your time and, contact information if you want to contact us and ask any questions about the guidebook or provide feedback. But yeah. Cool. Any questions?